Hey everybody, welcome back. This lesson is about the airways and lungs as seen in CT imaging. We'll start with a coronal image. This is a coronal reformation of the chest. The image has been processed with the lung algorithm to increase spatial resolution and demonstrate the finer details of the airways and lungs. Notice that the windowing technique is very different from what we've seen before. The window width is very large, about 1800. Not as large as the bone window width, but still much larger than usual. The lung tissues are naturally extremely high in contrast, so high that we must use a wide window width to decrease the visible contrast. Notice that the window level is a negative number, usually about negative 600. Negative 600 corresponds to the average Hounsfield value of the lung tissue. The window level is always set to match the Hounsfield value of the tissues we are most interested in seeing. This coronal image is very helpful because it demonstrates a large extent of the tracheobronchial tree. That's the branching system of airways that carry air into the lungs. This large tubular structure is the trachea. The trachea is a cartilaginous tube that connects the upper respiratory tract to the lungs. It extends from the larynx at the level of about C6 to the level of T4, where it divides into the two primary bronchi at the carina. This point is the carina. The carina is the cartilaginous ridge at the base of the trachea, where the trachea divides into the right main bronchus and the left main bronchus. Sometimes these structures are called the right and left primary bronchi. The right main bronchus carries air into the right lung, and the left main bronchus carries air into the left lung. Structurally, the trachea and bronchi are composed of imperfect rings of hyaline cartilage, fibrous tissues, muscular fibers, and a mucosal membrane. The right and left main bronchi immediately begin branching into smaller and smaller air passages. We can see some of these within the right lung. The primary bronchi branch into secondary bronchi, also called lobar bronchi. They're called lobar bronchi because they correspond to the specific lobes of each lung. This branch is specifically called the right lower lobar bronchus because it supplies air to the right lower lobe. The lobar or secondary bronchi branch into numerous tertiary bronchi, also called segmental bronchi. Tertiary means third, meaning this is the third series of branches. They're called the segmental bronchi because they branch into the various segments within each lobe. Segmental bronchi continue branching into smaller and smaller passageways until they become the bronchioles. These are tiny tubular structures that carry air into the alveoli, the functional units of the lungs that are responsible for gas exchange. The gross anatomy of the lungs can also be seen in this coronal reformation. The lungs are the organs of respiration. Both lungs are divided into lobes. The right lung has 3 lobes and the left lung has 2 lobes. These lobes are separated by fissures. In fact, at this slice position, we can see the oblique fissure of the right lung. If the fissure is visible at all, it should appear just like this, as a very thin white line. The right and left lungs are not identical in every way, but they both have an oblique fissure. The oblique fissure, also called the major fissure, divides the lung into upper and lower lobes. We can see the right upper lobe above this fissure, and we can see the right lower lobe below this fissure. The right lung also has a middle lobe, not visible in this image, that is below the level of this fissure. Each lung is enclosed in a pleural sac, consisting of an inner visceral pleura directly adhering to the lung surface and an outer parietal pleura lining the thoracic cavity. In CT imaging, this pleural sac really is not visible. The tissues are very thin, and there's usually nothing within that pleural space. Now we'll look at the axial plane. In the center of the image, we can see the trachea. The trachea is a cartilaginous tube that connects the upper respiratory tract to the lungs. In CT imaging, the trachea should appear just like this. It should be perfectly round, with a smooth border and totally filled with air. Any variation in its appearance could indicate a serious pathology. In the left lung, we can faintly see the oblique fissure, also called the major fissure. The oblique fissure separates the lung into upper and lower lobes. On the anterior side, we can see the left upper lobe. On the posterior side, we can see the left lower lobe. Moving inferiorly in the axial plane, we're now at the level of the carina. The carina is this cartilaginous ridge at the base of the trachea, where the trachea divides into the right main bronchus and the left main bronchus. These main bronchi immediately divide into smaller and smaller branches until they eventually terminate at the alveoli. In the right lung, we can see some of these segmental bronchi, also called the tertiary bronchi. We can also see several very, very small branches called the bronchioles. Moving inferiorly in the axial plane, we can still see the right and left main bronchi. On the left side, we can see several branches of this tracheobronchial tree. We can see the lobar bronchi branching from the left main bronchus. Specifically, this would be called the left upper lobar bronchi because it's supplying air into the left upper lobe. On the posterior side of the left lung, we can see one of these segmental bronchi and several of the very tiny bronchioles. One more slice in the axial plane. In this CT axial view of the lower thorax, the lungs might look different than expected. We can see the right and left lungs, but only on the posterior side of the image. That's because the lungs extend much lower on the posterior side compared to the anterior side of the body. That means that at this slice position, we are seeing a portion of the thoracic cavity, but also a large portion of the abdominal cavity. For example, on the right side, we can see the liver, and on the left side, we can see the spleen. Thanks for watching. That's been a review of the airways and lungs as seen in CT imaging.